From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into OpenLine. I'm Chuck Long, glad to be along with you for the next hour. Tonight is Ask the Expert, and our expert is Dr. Christopher Sandlin, endodontist. And, you know, when it comes to that, when we're talking about your teeth, I know there's a lot of questions that you'll have every time that we have either Dr. Horwath or Dr. Sandlin on from Bluegrass Endodontics. We get a lot of calls. There's a lot of things that come to play when you're thinking about your mouth, whether it's a root canal, whether you're thinking about your gums, whether you're just thinking about what's the best toothpaste to use. We'll take all those calls that we can get to tonight. As always, the number to call is 737-7587. That's 737+. This is your forum. This is your chance to ask those questions that you may be having about your teeth tonight. So, Dr. Christopher Sandlin, great to have you with us this evening.
Thanks for having me. It's a pleasure to be here.
So, always good to see you guys. Now, you know, when we start thinking about the mouth and an endodontist, for people just tuning in, if this is the first time that they've seen the show and we're talking about the teeth, when do you go normally to the endodontist? What's the first sign that you need to go?
Well, usually it's your general dentist who quarterbacks that call and says, hey, I think we've got some issues here. We need to send you over to an endodontist. Some general dentists do root canals. Some understand that may be a little more challenging of a case than they're comfortable with, so they refer out to the specialists. Every once in a while we get a patient that's savvy enough or been down that road and they understand, hey, these are the symptoms I had last time. I'm going to just go directly to the endodontist. But usually it's a referral from the general dentist.
And do you generally, too, recommend if you are having questions, problems, see your dentist first, or if someone does think that they might need a root canal, just to come directly to you?
Generally, it's probably a better idea through the course of regular dental visits, because they're more in tune with your overall treatment plan and your health care, your dental care. And so they've got a good idea. If it's something that doesn't warrant a root canal, they can head that off and take care of those issues before it ends up in my door.
Now, you know, one of the things that I guess, and I'm sure that you deal with this or you're aware of it, I would say 10, 20 years ago, there was somewhat of a stigma when someone said root canal. I mean, people thought, oh my gosh, I'm going to be off work for days. Is it painful? There was a fear of it. That has changed a lot in the last.
It sure has. As part of our training, we actually had to go back and do a report on the history of endodontics. And when you do that, you do gain an appreciation for some of the torturous stories that are recanted. But generally speaking, I tell patients root canals are not supposed to be an uncomfortable procedure. They may be slightly awkward. Sometimes we're working way in the back of the mouth. We use isolation with the rubber dam. So there's a lot of stuff going on. But anyone worth their weight can get you numb, and you're numb for a root canal, you're numb for an extraction, you're numb for a filling. It's all the same. You're either numb or you're not numb. So we have ways to test to prove to the patient, yes, you are in fact numb. And generally, once we can jump that hurdle in the patient's mind, they feel confident that yes, I am in fact numb, the rest of the procedure goes by pretty well.
Well, and two, I know that we've had questions in the past. Sometimes people think, well, I want to do anything that I can to avoid whether it's you know, if I've already got maybe the caps or the crowns and that sort of thing, and someone says I might have to have a root canal. What do you say to that?
You either need it or you don't.
Mm-hmm.
The crown, we can go through the crown. That's not a problem. Generally, we can make a nice conservative opening through the top of the crown. And then when we're done, the general dentist or we can place a restoration that plugs that hole, and so you never even know.
So it's not a big deal. Someone who
thinks...
It's
not a big deal.
Right. What about dentures? Now, we've also had questions when people say, you know, I think I'm just going to make it easy. I'm just going to get dentures. What's your feeling about that?
Well, a properly made set of dentures, especially when you're talking about the lower arch in particular, a perfectly made set of dentures, if I recall this correctly, will only provide you about 25% of the function that you have with your natural teeth. Now, nowadays, there are other options as opposed to just the conventional pop-them-in dentures. You can do what's called an implant-supported denture, where you place maybe 2 implants on each side, and then your denture will clip into that. And that certainly will increase the functionality of the denture, but your natural teeth are still the best way to go, provide you the best amount of function.
Right. And is there a proper way to care for your teeth so that you prevent having to have a root canal? Is there anything about care and that goes into it?
Good home care, good oral hygiene, brushing, proper technique, change your toothbrush, flossing. As we get older, I tell patients flossing becomes more and more important. Periodontal disease becomes more prevalent as you age. But good home care, good routine visits to your general dentist, and that'll ward off a lot.
Okay, well, that is good to know. As always, 737-7587 is the number to call. If you have any questions about not only maybe do you need a root canal or possibly saving a tooth or a chipped tooth, something like that, or maybe you've had an unpleasant experience and you just want some more advice on it, Dr. Sandlin here from Bluegrass Endodontics is here to answer your questions here on Open Line. Now, chipped teeth, when someone chips a tooth, should they immediately go to the dentist, or is it okay, or do they wait, you know, if it's painful, is that your sign to go? What's your recommendation?
Well, a chipped tooth, it immediately brings to mind an unaesthetic situation, so I would imagine that most people that have a chipped tooth are going to see their general dentist just for that alone, to replace that aesthetic appearance. And additionally, as you chip away part of the outer protective covering of the tooth, it's going to expose some of the more porous, sensitive tooth structure on the inside, and so that is also an incentive to see your dentist so that they can cover that with a restoration that looks good and decreases sensitivity.
And root canals, why does someone need a root canal? What happens?
The inside of the tooth is a hollow chamber inside the crown, and then off of that down each root is a hollow channel, and that's where all the tissue, nerve, blood vessels enter into the tooth. Now, as you're young, that soft tissue has a formative purpose. It helps to form the tooth, but as an adult, it really doesn't do much other than to tell you, hey, that coffee's hot, that ice cream is very cold. And so if you don't have it, it's not really going to affect the function of the tooth. That tissue inside the tooth is in what we call a low compliant environment, meaning when it's insulted over the course of multiple restorations, chipped teeth, fractures, cavities, that tissue doesn't really have the luxury of swelling and expanding to absorb that insult. As a result, that tissue becomes inflamed, it'll throb, it'll hurt, it'll wake you up in the middle of the night. Eventually that tissue will die and cause an abscess. That's a whole nother bag of symptoms that you generally don't want. So when we do a root canal, we just remove that angry tissue from the inside of the tooth and replace it with something inert like rubber.
Well, sounds easy enough. So, and you know, and again, it's not something that people need to fear, you know, having. We're going to go to our lines right now. Helene is on the line with us. Good evening, Helene. Do you have a question or a comment for Dr. Sandlin?
Yes.
Okay, so go right ahead.
I have a mouthful of crowns and bridges, and my teeth are rotting or decaying above where the bridges and the caps are put on. So now what am I going to do? Have them all pulled?
Well, the ideal situation is, if you know there's decay, is to remove the restoration and clean off the decay, and then if you have to, you may have to have a crown or a bridge remade. That's the ideal situation. Anything short of that, you're kind of burying your head in the sand if you think that it's going to work. Eventually, that decay will continue to progress to the point where you do need root canals. And then you'll still need to replace the restoration on top. So as soon as you...
Some of them has root canals in them already.
Well, one of the common misconceptions with teeth that have root canals is, I'm done with that tooth. And much like a pulp that can become irritated and contaminated by bacteria, the material that we use inside of a root canal is also subject to contamination. So if the restoration on top, your crown or your bridge, is leaking, ultimately that will contaminate the root canal. Now, in addition to having to replace the crown or the bridge, you'll also have to replace the root canal.
Okay.
All right. Well, Helene, hopefully that is some good advice that you can take, and we do appreciate you calling in this evening.
Well, say upper teeth, I've got every one of them, but they're all bridges except 3. So I'm inclined to believe that the best thing to do is have them pulled and have a denture put in.
On the upper, it's not as big of a deal. Obviously, the more teeth that you can save, that will provide additional support. You can still have an upper denture and utilize the support of your remaining teeth, but it's still advantageous to hold on to as many teeth as you can.
I only have 3 that's good in the top.
Hold on to those 3.
Hold on, that's it. Okay, well, Helene, again, thank you so much for calling. Have a great evening. We appreciate you joining us here on Open Line. As always, this is your forum. 737-7587 is the number. We're going to take a short break and more on Open Line right after this.